Today we're going to put on the fetal monitor. We're going to monitor this pregnant woman while she's in labor. First thing I'll do is wash my hands, knock on the door, go in the room, provide for privacy, raise the bed up, identify myself, identify my patient, put my gloves on. I'm going to put this Toco transducer on her. I'm going to put it at the apex of the uterus or at the fundus. This is going to monitor her contractions. I'm going to strap it on. And I'm going to put this ultrasound on to measure the baby's heart rate. I'm going to do the Leopold's maneuver to find the baby's spine, and I want to place it at the spot of max intensity. So I'm going to strap it on too. The heart rate should be between 110 and 160. And after I get these on, I'm going to check the monitor to check her contractions and check the baby's heart rate, make sure everything looks good there. So I would take my gloves off, lower to bed, make sure she doesn't need anything, be sure she has her call light, tell her I'll be back to check on her, and go document. Then I'm going to, now she's just had her baby, so we're going to do her postpartum assessment. So I'm going to knock on the door, go in. My name's Jaclyn, I'm going to be your nurse. I'm going to do a quick assessment on you since you just had your baby. Identify her with her name and date of birth and her bracelet, and raise my bed, provide for privacy. First thing I'm going to do is ask her if she has been to the bathroom lately or if she needs to go. She tells me she just went, so that's good. We can continue on with our assessment. First thing I would do is check her breasts. We're making sure she has a bra on, checking for any redness, engorgements. If she's breastfeeding, check for any cracks or bleeding. Be sure she knows what to look for. If she's not breastfeeding, I want to educate her on not stimulating milk production. Then I would listen to her bowel sounds. She has bowel sounds present in all 4 quadrants. I'm going to do a fundal massage to palpate the uterus, and I want to stabilize the bottom of it and check for the fundus. I want to feel for the top of it, and it should be midline at or 1 finger below or above the umbilicus. It should be firm. If it's not, she's at a risk for hemorrhage. I want to ask her about her bowel and bladder habits. She says she went to the bathroom this morning, her bowels moved, so that's good. She says she's urinating, okay too. I'm gonna have her help her roll over on her side to check her lochia. So I would check for, be sure it's light to moderate. Notify the provider if she has heavy bleeding. It's expected to be moderate right after she has the baby. I'm also going to check for hemorrhoids. I'm going to check her episiotomy. If she had a C-section, I would check her incision to be sure everything looks good. It doesn't look red or infectious or anything. I'm going to, if I needed to do pericare, I would remove her pad front to back and then replace it front to back also. I'm gonna change my gloves, wash my hands, check for edema in her lower extremities. If her legs and her ankles, if there's edema on one side, that would indicate a DVT. Everything looks good there. I'm also going to check her arms. her hands and her face for any swelling. Then I'm gonna check her emotions, ask her how she's bonding with her baby, make sure her emotions are all okay, she's doing okay with the baby, and finally I'm gonna ask her about any pain that she might be having, and she tells me she's not having any. So I will take my gloves off, wash my hands, lower the bed, be sure she has her call light. If she doesn't need anything, tell her I'll be back in a little bit to check on her and to call me if she needs anything. Wash my hands and go document.